All right, my name is Dr. Sara Rodgers. I'm a naturopathic physician and own Idaho Naturopathic Medicine in Boise, Idaho, and also an office in Ontario, Oregon. It is my pleasure to introduce one of my friends today, Dominique Tardif of Healing Arts Boise in Boise, Idaho. Welcome, Dominique.
Thank you, Sarah. Nice to be here.
Yeah, so Dominique's one of the people that I refer to as for therapies other than what I provide. I do this a lot for my patients. I don't provide everything, and I like my patients to see. And Dominique's been a highly trained licensed massage therapist. Is that right, Dominique?
Yes. Yes.
You were trained to do regular massage, but you also have expanded your practice to craniosacral therapy.
Correct.
Visceral massage, and you also have done some neuromeningeal evaluation manipulation. You've done some star trauma release and some heart-centered therapy.
That's right.
Training. So you're highly trained, and my understanding is you've transitioned your work from actually doing hands-on deep tissue massage to doing more of these emotional release techniques. Is that right? Can you explain what you do?
Yeah, it's a mix. So the knowledge I have, having been a deep tissue sports massage therapist for a long time, has allowed me a pretty deep understanding of anatomy and physiology.
Mm-hmm.
And now with the emphasis on craniosacral therapy, which is considered an osteopathic manual therapy, it's a physical therapy. It's just very, very light.
Mm-hmm.
I can bring in aspects of visceral manipulation, neuromeningeal manipulation, emotional trauma release, somato-emotional release into a session to allow for whatever it is that the client needs addressed or released in that session to happen.
That is awesome. That is awesome. And you've been getting great results.
For the most part, as we know, the relationship between a practitioner and a client, there has to be a little chemistry, a little magic that happens between the two. So sometimes it's not a good fit. And if it's not a good fit with a client, I refer them to someone else who's got similar training as me. But the results, for the most part, have been really positive.
Yeah, and I'm really glad that you're doing the work that you're doing. With the COVID-19 epidemic, it's been really hard on people, both socially and economically, and there's been a lot of anxiety going on. And my understanding is you've been transitioning your practice to be able to help people who can't come into the office. Can you talk a little bit about that?
Yeah, sure. So I did close down my office and attended an online training of how to do sessions through the phone or through Zoom like this, to try to find ways to be able to support people through this sustained amount of stress that we're all experiencing.
Mm-hmm.
So what we have discovered is that it's possible. It seems to be best with a phone call so that someone can be laying down or reclined in a comfortable chair and be able to really kind of close their eyes and drop into a quiet space. It's actually quite possible to be able to help someone tune into their own being, their own body, find out what little discomfort is happening in there, and then drop into that and support it to see what that part needs to be able to create some calmness and some peace and some ease. Maybe it will resolve an emotional issue. Maybe it's just a way to be able to really recognize that a part of the body is really holding on to something, and that maybe it doesn't need to be quite so clenched and so tight.
Mm-hmm.
I have some grounding exercises to help breathe someone through some tension. I have heart math breathing techniques to help calm the central nervous system. So I have very similar tools to what I would use if someone were on a table in my treatment room. I can apply these on a telehealth session, and I've been having really good results.
That's really exciting. So it looks a little different from what you do in your office versus on telehealth. Can you describe what you're actually doing in your office?
Yeah, so in my office, someone will be laying on their back, supine, fully dressed, on a really comfortable treatment table that has 3 inches of memory foam, so they just kind of sink into this comfy table. And my hands gently start on their tops of their feet just to kind of dial into their system to see what's happening. And then I would be working through the person's physical body with my hands, sometimes often sandwiching, like maybe a hand on the sacrum and a hand on the belly, or my hands underneath the base of their skull with my fingers on their temples, or up, right here on their chest. So they feel my hands, but we use 5 grams of pressure. So it's just the weight of my hand, and then start adding up to 5 grams of pressure, and then allow the tissue to soften underneath that and release whatever it needs to release. So it's a physical, really calming kind of treatment. And what can often happen is as the tissue starts to soften, all of a sudden there might be a little upwelling of emotion, because maybe that tightness has been kind of holding in something that hasn't been addressed yet. And I'm not a licensed talk therapist, I'm not a counselor, but I'm trained to hold a space for someone to be able to let something else that maybe has been a little bit bottled up, and maybe actually gently kind of get to the root of whatever it is that causes that response or that reaction, and get some resolution with it. So really, I'm a facilitator to help create a space to resolve something that
Nice.
needs resolving in that moment. And what we understand as craniosacral therapists is that all of us have a really deep inner wisdom, kind of a deep inner knowing. So a client's inner knowing is usually not going to allow that client to go to a place that's not safe, to go to a place that's not okay for them to go to in that session with that practitioner. So it's a very safe and kind, supportive environment.
Yeah, it sounds lovely. It sounds lovely. And do you feel like you can be doing some of the same or similar processes on a telehealth phone call?
I do. And actually, it's been kind of a surprise for me, because I've been a little bit skeptical that you could do this on a phone call or in video. And yet I've done, since the pandemic shut down and things are reopening, I've now done 10 sessions, and people have found, my clients have had headaches go away, tinnitus go down. This is what a client that had a traumatic brain injury. Somebody else who has had this chronic whiplash issue from a car accident. She could feel the changes in her neck, and she was able to get a couple of days of relief. I just did a session today with someone who I've never actually worked with before physically in my treatment room. She lives in a different state in California, and though she is a massage therapist, so she understands what this bodywork thing is. When we were done after an hour of just doing this on the phone, she said, "Wow, I feel like I just had an hour of good bodywork."
Nice.
So yes, it's kind of remarkable. And if I hadn't received some distance sessions on the phone myself from some therapists, I don't know that I would have believed that this can happen. But it has really been a powerful experience for the clients and for me.
Yeah, that sounds amazing. I've been really appreciative of being able to do telehealth with my patients as well. And, we live in a crazy time right now, but also with technology, we live in a time where we can provide services that we wouldn't otherwise be able to provide, say if it was 50 years earlier.
Right.
There's sort of scariness, but we have these tools, and I always try to get myself and hopefully my patients to think about all the things we can be grateful for. So I'm really glad that I could share this, share you with my patients so they understand what you do, and that you might be of service to them. Do you have anything else you would like to add or share about your practice?
Yeah, maybe a little bit about, for folks who don't really know what craniosacral therapy is. It's what I've described of what can happen in a treatment room helps support issues such as chronic anxiety, headaches, migraines, recovery from an automobile accident, post-concussion syndrome, recovery from surgery, because there's some, it's sort of traumatic to have surgery. So after all the wounds and everything have healed up, do some work to help soften that. And sometimes I'm the last resort practitioner. Like someone comes to me and says, well, I've tried everything. I've done PT, I've done acupuncture, I've done this, I've done that. Nothing's working. So I thought I would try this. And often we can start a healing process that the other modalities haven't been able to really get to.
Right.
And then once that starts opening up, often then all those other techniques that they had tried might actually be able to have some efficacy
Right.
again. So what I do sometimes is just a really nice way to soften the body enough, to soften the person enough for them to be able to then really deeply receive treatments from all the other modalities. So I really enjoy teaming up with other practitioners, and sometimes we'll work with someone maybe 3 to 5 or 6 sessions, maybe once a week or maybe every other week, and kind of work that way, and then say, okay, now go try the acupuncture again. And let's not
Right.
do it in the same week or the same day. So I have a lot of cross referrals with like you and other practitioners to help create a network or a team of people for clients to be able to finally really come to a place of resilience and the best health they can get to. So, and I'm super excited at the possibility of doing this online through the phone. It just
Yeah.
expands things, because if there are clients that are in rural areas that are
Right.
far away that aren't going to drive all the way to Boise, you know?
Right. Yes. And yeah, I think one of the things that this epidemic has done is provide an avenue for people who wouldn't already have services, or had a hard time getting services. Now with the expansion of doing telehealth, that we can now provide services better to a wider area within the licensing area. So that's been wonderful.
Yeah. So one of the things I've been envisioning is if someone is able to come into my treatment room at some point and we do a session, that if they live far away, instead of having to wait until they can make it back to my office, that maybe then I can support their process through phone sessions until they have an opportunity to come back into my office again.
Well, I look forward to hearing how that goes for you, and see how successful that is. And I think it's wonderful.
Okay,
So
well,
if
thank you.
people want to get a hold of you, what is your contact information?
So my website is www.healingartsboise.com. My email is my first name, and I'll spell it because it's long. It's Dominique, DOMINIQUE healingartsboise@gmail.com. And my phone number and everything is listed on my website. People can schedule sessions online if they want to. There's lots of information of all the different things I do, and I'm happy to answer any questions if somebody reaches out.
Well, that's great. Well, thank you for spending the time with us. And I will be posting this on my website and also be sending it out on the newsletter. So I'm really grateful for your time today.
Well, thank you so much for offering me this opportunity to talk with you, Sarah. This has been really delightful.
You're welcome. Well, I hope you have a great day.
Thanks, you too.
All right. Bye-bye.
All right, bye-bye.